Um, I'm going to talk to you today about faith and health. I'm a professor at Duke University Medical Center here in Durham, North Carolina, and I've done a lot of research over the last 40 years on this topic of faith and health. So with that, I will simply begin. So I'd like to review some of the research on religion and health, then describe a theoretical model explaining the effects, come to some conclusions based on the research, and then provide you with some further resources. I believe we will also have a little time at the end for some questions, so I would welcome. So first, let's look at the research on faith and mental health. A lot of this research has been documented in the third edition of the Handbook of Religion and Health that is coming out spring of 2022, this coming spring, maybe late spring. It's got a lot of research in it. It's about 2,000 pages, close to 600,000 words. And the research that's been, the best research that's been done is reviewed in this book. Now, if you want to learn more about this area, particularly the mental health area, then I do have a book that's out right now, published by Academic Press on the topic of religion and health. It's focused on mental health. Got a couple of articles in the British Journal of Psychiatry Advances, one on recent developments in research, and then one on clinical applications. So if you're interested, you could go to those references as well for a recent update. Let's start out with depression. What is the connection between faith and depression? Well, depression is one of the most common emotional disorders in the world and is the most disabling, especially among medical patients. Religious involvement, however, is related to less depression, faster recovery from depression, and is responsive to religious interventions directed at reducing the depression. So that's true for over 60% of the studies that have been published in this area. This is a more recent study. This is from the Harvard School of Public Health. This is a 3 to 6 year prospective study of about 10,000 young people, average age 23. So these are all among young people, and they're followed over time, and they're looking at the effects of frequency of religious attendance at baseline on the risk of developing a depressive disorder during that 3 to 6 year time frame. And this is a very, very well done study. It's out of the Harvard School of Public Health, and it's published in a top epidemiological journal, the International Journal of Epidemiology. What they found was a more than 30% reduction in risk of developing a depression among those attending religious services at least weekly or more often. Suicide. So based on a systematic review in the second edition of the handbook, we found that there were 141 quantitative studies that actually measured this involvement and looked at the risk of completed suicide, suicide attempts, and suicidal thoughts. And of those 141 studies, 75% found less of the suicidal thoughts, attempts, and completions among those who were more religious. This is a study. It's a study of a random sample of over 20,000 US adults in the United States. And this is over an 18-year follow-up period from 1988 to 2006. And they looked at the risk of completed suicide based on frequency of attendance at religious services. So what they found was that among those attending religious services at least twice a month, risk of dying from suicide was 94% lower compared to those who attended services less than twice a month. So that's a very large effect size. Now, this is a study of 90,000 women, all nurses in the United States, that have been followed for a period of 14 years. So they looked at the risk of dying from suicide per 100,000 person years, finding that compared to those who attended at least once a week, that compared to those who never attended, there was a 7-time greater risk of dying from suicide among those who never attended religious services compared to those who attended at least weekly or more often. And when you look at the risk of suicide after taking into account many other factors that potentially could increase the risk of suicide, there was a 84% reduction in risk of suicide, very similar to the 94% reduction in risk of suicide among Americans in general. Now, this is a study, again, looking at the nurses as part of the Nurses' Health Study. These nurses were followed for 16 years, 66,492, and they looked at deaths from alcohol, drugs, and suicide. And what they found, after controlling for taking into account many other risk factors for suicide, psychological, demographic, social, physical health risk factors, there is a nearly 70% reduction in risk of dying from a death of despair, nearly a 70% reduction. And there was a P for trend, which is an important to be aware of that, because that means that there was an actual gradient of effect. In other words, the more the person attended religious services, the lower was their risk of dying of a death of despair due to alcohol, drugs, or suicide. And this is, again, coming out of the Harvard School of Public Health and is in the best academic psychiatry journal in the world. That's JAMA Psychiatry. Now, this one here was all among women. What about men? So this is looking over a 26-year time period, risk of dying from a death of despair, again, due to alcohol, drugs, or suicide, among 43,000 men, dentists, pharmacists, optometrists, osteopaths, veterinarians, examining, again, the deaths of despair. And what they found was nearly a 50% reduction in risk of dying of a death of despair among those attending religious services weekly. And again, you have a significant P for trend of effect. The more attendance, the lower the likelihood of dying from a death of despair. Now, this is a study looking at high-risk adolescents, high-risk young people, ages 11 to 16, who were followed for 18 months, looking at whether or not these high-risk adolescents who had actually been referred to child protective services because of child abuse or neglect, following them for 18 months, those youth who indicated that religion was very important in their life were more than half less likely, more than 50% less likely to develop a substance use disorder. Okay, so that's quite an effect also. Let's now look at the positive aspects of mental health, well-being, and happiness. This is based on our systematic review that was published in the second edition of the Handbook of Religion and Health. There were 326 total studies that were identified. These are all quantitative, all published in peer-review academic journals. And of those 326, nearly 80% found that religious people were happier, greater well-being, and were more satisfied with their life. And of the very best studies, even a higher percentage found those results. And of the 326 studies, bear in mind again, this is a systematic review of all studies out there published in the academic literature. Only 3 studies found lower well-being or happiness among the more religious. That's less than 1% compared to 80%. Meaning, purpose, hope, and optimism. All of those are higher among people who are more engaged in their religious faith tradition. Greater meaning and purpose, over 90%. Greater hope, greater optimism. So positive emotions are much more common among those who have a strong faith. What about physical health? So in terms of cardiovascular functions, we know that heart disease is the most common cause of death in the United States and around the world. So religious involvement is related to better cardiovascular health, lower blood pressure, lower cardiovascular reactivity to stress, greater heart rate variability, greater levels of C-reactive protein in the blood, which indicates a better lower inflammation in the body. Inflammation is a very strong predictor of increased risk of heart disease. Overall, there was nearly 2/3 of studies showed that religious people just are less likely to develop coronary heart disease. Excuse me. Okay, what about the incidence of hypertension? The recent study, this is a study published in the American Journal of Epidemiology, again by the Harvard School of Public Health. These, again, are the nurses, 44,000 nurses without any evidence of high blood pressure at the start of the study. And then they looked at the development of hypertension during the 12 years of follow-up. And what they found was that there is a nearly 10% lower likelihood of developing high blood pressure among those who are attending religious services at least once a week or more than once a week. And again, these analyses were carefully controlled for many other predictors of high blood pressure, 25 other socio-demographic, psychological, and physical health characteristics. Again, there was this P4 trend, suggesting that the greater the attendance, the lower the risk of high blood pressure. The same found with regard to death from stroke or cerebrovascular disease. So death from stroke was significantly less common among those who are attending religious services to any degree. Again, published in a very prominent journal, JAMA Internal Medicine, 16-year prospective study of 75,000 American nurses. Now, this is a study of Muslims in Iran. So in this study, the researchers, it's called a case control study. The researchers compared 190 hospitalized patients with coronary heart disease, those were the cases, and matched them on age and gender with 383 controls without heart disease. After taking into account family history of cardiovascular disease, smoking, passive exposure to smoke, birthplace, marital status, education, job category, past medical history, fasting blood sugar, high density lipoprotein, triglyceride, and total cholesterol, and blood pressure. After controlling for all of that, individuals who are more religious, Muslims who are more religious, have a significantly lower risk of having coronary heart disease, anywhere from 70 to 74%. What about mortality, all-cause mortality? So systematic review, we identified 120 studies, of which 82 found that religious people just live longer. In 7 of those studies, they found that they didn't live as long. But in several of these studies here, they were looking at people like in nursing homes, people who were already older, who were getting closer to death. And so naturally, they were more religious because they were getting closer to death. So that's probably explains this. But this finding here is indisputable. So here is another study from the Harvard School of Public Health, the best school of public health in the world, Harvard University, published in JAMA Internal Medicine, one of the top internal medicine journals in the world. They followed these 74,000 women for 14 years, finding that those attending more than once a week were at 1/3 lower risk of mortality during those 16 years. And if they attended once a week, there was a 25% reduction in mortality. And if they attended services less than once a week, then the effect was smaller. Again, you see a gradient of effect that was highly significant, meaning, once again, the more frequent the attendance, the greater the longevity. It's just as simple as that. Now, in terms, they then broke it down by, deaths from various conditions. And they found that those dying of cardiovascular mortality was also lower by over 25%, and among those attending more than once a week, and by 20% in those attending once a week. And then again, you see this gradient of effect, meaning the greater the service attendance, the lower the risk of dying from a heart attack. The same for cancer mortality. Again, the greater the attendance, the lower the risk of dying from cancer. And again, showing a gradient of effect. Now, this is among young people. This is 10,000 young people, average age of 23, that are followed for 3 to 6 years, looking at the risk of developing cancer. So not many people that young develop cancer, but young people of that age attending religious services more often were more than 60% lower risk of developing cancer. And that was statistically significant. So apparently attending religious services has lots of effects on people's health, both their longevity and even their development of cancer, as well as development of heart disease. Okay, we're moving along here. So basically, this summarizes all of the studies on the relationship between religion and health. And you can see here, these are the number of study in the thousands. And basically, I'm going to summarize here. This graph right here shows the number of studies that show a statistically significant relationship between religious involvement and better mental health, social health, physical health, behavioral health in all respects here. Here is a model to explain how religion influences health. Now, this is for the monotheistic religious traditions of Islam, Christianity, and Judaism. So the source of all of these benefits have to do with belief in and attachment to God. So that is manifested by faith in God, trust in God, hope in God, and love of God, the one and only God that is indivisible. Now, this is nourished within the religious community and within the family and peer influences, and this is expressed in terms of religious practices and religious commitments and religious experiences. And all of these then influence these human virtues, making people more forgiving, more honest, more self-disciplined, more altruistic, more generous, more humble, more grateful, more patient, more dependable. And all of this also influences about health and health behaviors and health maintenance. And these, of course, all influence positive emotions and social connections and negative emotions as well, resulting in better nervous system, immune, and endocrine and cardiovascular functions, better physical health, greater longevity. Okay, so in conclusion, religious involvement is related to better mental, social, and physical health. These findings have huge implications for public health in the United States and countries worldwide in terms of healthcare costs, as religious involvement becomes less common with younger generations. So further resources, here's our e-newsletter. I would encourage you to sign up for it. You get it every month. I review the latest research. Just go to our website, sign up for the e-newsletter. And next is our research workshop. I would encourage you to come this year or this coming year, 2022, August 15 through 19. If you want to learn about this whole area, if you want to learn about the research, about the applications, you want to meet people from all different faith traditions, come to the workshop. I know that one of your colleagues the workshop this past year and really loved the workshop, and she then encouraged me to give this presentation. Send me an email if you're interested, and there are partial tuition scholarships available. Now, here's a book that describes how to do research in this area, and we desperately need people conducting research in this area and getting it published so that it can influence the healthcare field. And here's our website. There's the address. If you know, just look up Duke University Spirituality and Health, and you'll get our website. Lots of information on this. So we have a little bit of time for discussion, about 5 to 10 minutes. So I would welcome a discussion from anyone. Anybody have any questions?
Yeah, I have a question.
Good.
Does these researchers involve the lifestyle of those people, the control and case groups? Because, you know, religious determines some differences between people, such as waking up in the early for praying, or preventing some food to eat, or things like that.
Exactly. And that's how religion influences health. It influences health by affecting people's health behaviors. So those who are more devoutly religious are more likely to pray 5 times a day. They're more likely to follow, you know, a diet that is healthy. They're less likely to do things that are bad for them. So religion teaches people to live a healthier lifestyle and to treat others better and to, you know, to do all of those things which are good for your health. So that's exactly how religion does it. it doesn't dismiss the benefits of religion just because it does it in part through health behaviors, but it does emphasize that the religious beliefs influence people's attitudes and behaviors, which then affect their health.
Okay.
So, yeah. So actually, health behaviors account for about 25% of the effect that religion has on health. But bear in mind, the other 75% has to do with the attitudes, the beliefs, and the practices. And those are extremely important in terms of health.
Is there any non-negative effect on health? I mean, the religion or religious? And another question is, do we know which religion is better than the others? Is there any studies on that?
There are no negative effects that religion has on health. And it's your religion is the one that is the most beneficial to health. Let me put it that way. No, I'm just kidding you a little bit here. Yes, if religion is used in a maladaptive way, and some people use religion for selfish reasons, they don't practice the religion for love of God and serving and surrender and submitting to God. So if religion is not practiced for that reason, then it's not going to have any health benefits, and it might even create some health problems. And really, about religion, within Christianity, certainly within Islam, people who are devout, love and serve God and submit their lives to Him are going to be healthier because God loves us. He wants us to be healthy. He wants us to be strong. He wants us to spread His love for us to other people, So yes, He created us to be healthy. And if we serve Him and submit to Him, we'll be healthy, healthier than we would otherwise, at least.
How about meditation? I know that some non-religious people do meditation. Is there any effects on the health?
Well, meditation does benefit people. It does help their health. Yes, it does. But in Islam, there are all sorts of forms of meditation, including mindfulness and focusing on the Quran and God's word. And so you don't have to do secular meditation to get the benefits. You can use your own faith tradition to derive these benefits. And they're even stronger. The benefits of meditation are stronger if meditation is done within the person's religious tradition, because the religious beliefs then boost the effects of the meditation on health. So I would strongly encourage, if you're going to meditate, do it, but do it within your faith tradition.
Thank you.
You're welcome. Very good questions. Okay, I think our time is up. So if there are no further questions, maybe one last question, if anybody has. And if
May I ask a question, Dr. Koenig?
No, usually not.
Thank you for your presentation. It was very nice. Thank you. We appreciate it so much. I was going to ask you, this is, by the way, Shabnam Unlu, if you remember me from the workshop.
Of course I remember you. That's why I'm kidding with you.
Thank you. My question is, what are the specific mechanisms, the cellular mechanisms involved in the strengthening of the immune system for someone who has faith? So I'm sure it's very complex. There are many, many mechanisms involved that are interacting with each other and that are affecting each other, that ultimately lead to behavioral changes and all the things that you mentioned. What are the specific mechanisms that have been studied and researched?
Well, one thing that we know, Sebnem, is that stress, psychological stress, emotional depression, and those kinds of things adversely affect the system and the endocrine system and increase inflammation in the body. And religious involvement helps to reduce that stress level and reduce the likelihood of being depressed. It doesn't eliminate it, but it reduces that likelihood. Therefore, those negative effects of psychological factors on the immune and endocrine systems are less common. Consequently, the person's immune system and endocrine hormonal system, stress hormones, are low and the immune system is strong. So that is how it works. It is very complex, but definitely show that, and it all makes sense too. If you're less stressed because you're praying, you have a good connection with God, then you're going to be happier, and you're going to be less depressed, and you're going to get along with others better, and consequently, all of those factors influence your health in the positive.
Thank you, Dr. Koenig. The thing is, you see, there is also another aspect that that may be involved. What about the spiritual, psychological benefits of having that spiritual connection with the divine? Like, for example, the metaphysical dimension. How much of that does that affect the biology of the human being? So we know the mind-body connection. How is that connection happening?
Okay, basically, there may be supernatural influences that religion has on the body, but we can't study those. We can only study the effects that religious faith has on your mental health, your social health, and your behaviors. And those then in turn affect physical health. So that's what we can study. And so that's about, that's what we can study. And that research definitely shows that there are benefits to having religious faith that go far beyond, just mental health or even social health or even physical health, but may have, even greater influence based on our, love of God. So with that, I'm going to have to leave. So thank you all for listening to me. God bless you all and stay safe. And, bye-bye.
Bye. Thank you.